Hello, welcome back. This video is for radiologic technology students to learn the radiographic criteria and positioning of temporomandibular joints. So the first picture we have here is of a patient in a Schuller TMJ position. The Schuller TMJ position requires that the patient be in a true lateral position with their IPL perpendicular to the IR. The angulation on the tube will be 25 to 30 degrees caudal. We'll be projecting the TMJ that is not of interest down inferiorly so that the TMJ of interest that is touching or closest to the IR will be left superior on our image. So this is Schuller positioning, patient in a true lateral with a 25 to 30 degree caudal angle. So let's look at the image here. I want to find both condyles for you and show you how we can tell that just by looking at this x-ray, we know that this is a Schuller position x-ray. Because I can find the condyle here. This is the condyle, the lower condyle. This is the condyle that is not of interest. This is the mandibular notch here. This is the ramus of that mandible. All right, so just kind of getting our bearings here. This is the condyle that has been projected out of the way, down lower with that caudal angle. The condyle of interest is directly in line with that condyle because the patient was placed in a true lateral position. So there's no rotation. So here we can see the condyle of interest seated in the temporomandibular fossa here. And this is a closed mouth TMJ Schuller position. If it were an open mouth, the condyle would be anterior to the temporomandibular fossa because there's a plane gliding motion that happens at the temporomandibular joint where when we open our mouth, our condyle will slide forward. And then when we close our mouth, our condyle slides posteriorly and seats itself in the temporomandibular fossa. All right, so the next image over here is called a law TMJ position. In the law TMJ position, the patient is going to rotate their face. Their head will rotate toward the IR 15 degrees. And the angulation of the tube will be 15 degrees caudal. Because with that rotation, we've already separated those condyles a little bit. So now we don't need as much angulation on the tube to separate them because we've already separated them anteriorly posteriorly a little bit. So 15 degree caudal angle, 15 degree rotation toward the IR. So in this one, we can clearly see the rotation by finding the condyle not of interest. All right, this is the condyle that was projected inferiorly and out of the way. But we can see that it clearly is not in line with the condyle of interest, which is projected more posteriorly, or it's rotated, I should say, rotated posteriorly because of that rotation of the patient's head. See, this ear, as the patient rotates toward the table, this ear, where this TMJ is, would rotate anteriorly. The TMJ of interest rotates posteriorly. So we'll be looking for the TMJ of interest on a law position to be projected more posteriorly than the TMJ that's not of interest. All right, but we can clearly see that there's rotation here. So we would be able to identify this image without even being there when they did the x-ray. We can look at this x-ray and say, oh, that's a law image. We can also identify the EAMs here. Right, we can identify the EAMs, the separation of the EAM here, and the separation of the condyles. And once again, this is a closed TMJ, closed mouth TMJ law position, because we can see the condyle seated in the TM fossa, and if it were open, then the condyle would be anterior to the TM fossa, and we would see the TM fossa clear of superimposition with the condyle. So I hope that this was helpful. Thank you for watching.